Hello and welcome to IAPMD's patient webinar, Understanding and Coping with Premenstrual Anger, Irritability and Hypersensitivity.
I'm at Brown University's medical school where I'm an assistant professor of psychiatry. I'm also a licensed clinical psychologist. And if you're interested in following me and what I do, you can find me at Twitter at JRPeters. I want to note that at the beginning of this, I have no conflicts or financial conflicts of interest to disclose. And let's get started. So why focus on irritability and anger? These are some of the most common symptoms in premenstrual disorders. People report irritability and anger, and also related symptoms like feeling sensitive to rejection, sensitive to their environment. So that's that hypersensitivity, and having conflict in their lives. And these are some of the hardest to deal with for many patients. They're directly distressing. It doesn't feel great to feel irritated and worked up for people. It can result in people doing things that they regret later and acting impulsively out of those emotions. And it can cause problems in all kinds of relationships for people. And that can be one of the ways we know that PMDD is particularly impairing in PMDs. So it's really important for us to understand what's going on with these symptoms in order to try to cope with them effectively. And that's what I'll be talking about today. So I'm going to start with talking about irritability. And what do we mean when we talk about irritability? So this is a tendency towards quickly experiencing annoyance, frustration, or anger. Basically, you think about yourself and your typical states. When you're feeling more irritable, the amount of stuff that makes you feel angry, irritated, frustrated, it goes way down. So even small things might bother you much more than they would when you're feeling less irritable. And you're more likely to find things frustrating, angering, or agitating. And typically this also involves heightened arousal and response. And this can go from just feeling a little amped up to people feeling overwhelmed with sometimes physical sensations that go with this, feeling agitated. And for some, it can involve then outbursts and impulsive aggression, whether that's, yelling at somebody, getting into some kind of fight, conflict, as a result of feeling really irritable and feeling the anger that can come with that. And we see that irritability is one of the earliest emerging and most consistent hormone-provoked symptom. And here's an image from a manuscript where people looked at actually, what if we take people who are known to have hormone sensitivity, like with PMDD, and we look at people who don't, and we see what happens when we give them hormones. And sure enough, we see this very quick change with anger and irritability in response to adding those hormones, as well as in response to withdrawing from those hormones. So what we're seeing here suggests that hormone flux for the people who are sensitive to it can very consistently tends to provoke irritability. And sure enough, when we also look in studies where we're observing groups of people with hormone sensitivity, we see similar patterns across the menstrual cycle, where irritability is often the piece that emerges earliest. So that can be as early as around often the mid-luteal part of the phase. So once you're at least a week into that luteal phase, that's when we're seeing irritability for some folks, peaking even, but then persisting until often menstruation. And a few things about what irritability tends to look like for people. So one thing that I think is both really important pieces of information and currently understudied is the fact that when we see people reporting that they feel irritable, they feel angry, it also seems to go with increased sensitivity for a whole range of stimuli, but the one that we hear the most tends to be low tolerance for unpleasant or aversive sounds, which is something called misophonia. So a lot of times this same state is really a broader hypersensitivity towards things in the environment. So sounds that you might not be bothered by at a time when you're not having that irritability symptom are now really unpleasant or even intolerable. And does seem like this may be related to worse quality sleep, which may go in either direction, or frankly, probably both, where if there are aspects of changes that affect your sleep and worsen sleep quality, that increases irritability, but then irritability may also increase sleep. And we know that there are these bidirectional relationships. So it's something to keep in mind, thinking about how sleep may be playing a role in this. Also of note, in adolescence especially, this may be linked to increased suicidality. When we look at samples of adult people who are menstruating, we tend to see increases in suicide ideation not fully synced up with irritability. Sometimes they tend to come on a little later and persist a little longer. In the limited research to date with adolescents, and I should emphasize this is really limited so far, it seems like for them, suicidality may track more with irritability. And so this may just reflect developmental changes in how we cope when we're feeling irritable. And for adolescents who are just earlier on in their life, that may trigger this suicidality. Whereas for adults, it may be other factors, other emotional, interpersonal factors that are more likely to bring on that suicide ideation. I also want to talk a little bit about what we think might be going on in the brain when this irritability is happening, in premenstrual irritability in particular. One of the things that seems likely is that the timing of irritability onset tracks really clearly onto progesterone surge in the cycle. Estrogen is also shifting at this point, but it's progesterone surge that's distinctive in this part of the cycle. And we also know that the shifts in estrogen, while they may be part of this too, might be working by furthering the effect of progesterone. They have this synergistic effect where estrogen coming up at the same time can make this even more intense. And we have a few theories and ideas and evidence, and some evidence as to why this might be happening in the brain. And this may involve at least two neurotransmitter systems in the brain. Excuse me one sec. So the first one I want to talk about is GABA receptors. GABA receptors are what tell your nervous system essentially to calm down, and they decrease its activation and the level of intensity of neurons firing in your brain. When GABA is released, when GABA is flowing in your brain, essentially it's bringing that down. And progesterone in your body gets metabolized to something called allopregnanolone. We often call it allo for short. And this connects to GABA receptors in your brain. So we know that there's a direct effect of progesterone on nervous system functioning. Now, for many folks, they experience this as actually kind of sedating, like you'd expect. We activate GABA receptors. GABA brings down excitatory activity in the brain. You feel a little more chill. You feel a little more calm. In fact, this is also how benzodiazepines or anti-anxiety meds often work. However, it seems like in terms of the allo, there's some people who have a different reaction, and that this may be part of the neural mechanisms underlying what we call hormone sensitivity. So people having different brain responses to typical hormone functioning. And for a subset of people, it seems like this activation, this effect of allo specifically in the brain, rather than having that more sedating effect, has the opposite and causes agitation. We don't fully understand why that's happening. There's some great research teams looking into this and trying to understand the details of why this works differently for some people than others. That would be wonderful information for understanding premenstrual disorders, but it seems likely that this is part of the picture. Another part of the picture likely is serotonin and serotonin systems. If you think about what it looks like when serotonin receptors are activated, this is often one of the many things it does is induce a state of feeling of well-being, feeling that things are okay. So if you think about it, this is also the flip side of that might be feeling under threat, feeling agitated and irritated. And one thing that we know from research on serotonin and impulsive aggression just across everybody, this isn't specific to premenstrual disorders, is that having lower levels in the brain, and in particular having less activation of serotonin receptors, may increase risk for impulsive aggression, which is probably something connected to irritability. And we see this in parts of the brain that are responsible for detecting threat and telling you there's a problem, something's wrong, that's the amygdala, as well as parts of the brain, the dorsal striatum, that tells you you should do something about this. And so one thing that may be happening is that there's some effect of hormones that is causing an alteration in the serotonin system so that it's tipping towards being irritated and aggressive. And sure enough, what we see is that for some people who have PMDD or PME, SSRIs can reduce that irritability in particular within 24 hours. And it's worth noting, we think of these drugs as antidepressants or sometimes anti-anxiety meds. This is working in a totally different way than how it treats depression. That will take 3 to 4 weeks to cause changes, whatever changes are involved, we don't even fully know, to treat depression. This works almost immediately. And so that is why we can do luteal phase dosing of this. And it's why it's one of the first line treatments for PMDD. And it seems to be particularly useful for these kinds of irritability symptoms, possibly less useful for some of the others. It's also worth noting that all of these systems, all of these things may vary within people. So because you're hormone sensitive doesn't mean you're going to have the same level necessarily cycle to cycle. We think that there may be a number of factors that can influence this, including across the lifespan. So it's possible that in puberty, when hormone levels are still more erratic, that this could be worse. It's also possible, if not likely, that as people go into perimenopause and menopause, as we know again, that those hormone levels can become even less regular, and that symptoms in general for people can become somewhat worse, that those may be particularly risky times across the lifespan for some of this. And also, I wanted to note that there's that stress and other factors that are going on in the here and now may also affect how this plays out for people cycle to cycle. There's also likely a genetic component here. There's a number of genes that regulate all of these different things that are going on in the brain. People are looking at this, including the way that genes change from across time and how they affect how much receptors we have, how receptors bind to things in the brain. And so there's definitely some ideas about this, but it's really early on in this research. So I can't tell you, oh, get tested for this gene, that'll tell you if you have that. That would be wonderful. I hope we get there someday. It may be also more complex than just whether you have a gene or not. All right, so now I want to talk a little bit about coping with this particular symptom. So that irritability, that increased agitation and frustration. And a lot of these strategies are adapted from dialectical behavior therapy, or in some cases right out of that. It's worth noting this is a type of therapy that is made to help people cope with intense and difficult to manage emotions. So even though it was designed initially for borderline personality disorder, this is something that is going to be useful. The skills in here for pretty much anybody who's having difficult to manage emotions. And so first off, I want to just note that it's helpful in some ways if we can anticipate this irritability. And that's where having the premenstrual effect could be useful in a way. I mean, it's not great to have it, but the fact that you know when it's going to happen can help us cope better. So it's so being able to understand when, if you have irritability that for you is cycling on and off, tracking that so that you can understand really when in your cycle is that starting to increase, when is it really getting the worst, and when does it drop off for you, may be really helpful in order to think about how to implement skills that could help you cope with that. in terms of behavioral skills that I think could be useful, one is limiting stimuli that can be irritating when possible. And this is with that big caveat that sometimes we cannot avoid being around things that increase irritability. But thinking about, so if you know there's a week where this is just much worse for you during the month than other times, thinking about, okay, is there unnecessary contact with people who are annoying that I can get out of, right? This is not a time to schedule, I don't know, a meetup with a friend who you like, but maybe also kind of gets on your nerves sometimes. Probably not the best week for that. Or maybe not the best week if you can control these things for certain kinds of appointments. It may be worth thinking about, do I need to have this discussion with somebody right now if it's going to frustrate me easily, and trying to postpone it. And also thinking about what aspects of your environment might be sources of irritability, since we know that that's a factor here. And again, sounds being one of these big ones, thinking about, okay, how can you make your environment in those times in particular less aversive in terms of the sounds? So it may mean needing to, if somebody is in your house and they're vacuuming, getting yourself away from it as soon as possible is a reasonable thing to do. There may be sounds you can't avoid. One of the things that comes up a lot is, what if you have small children who can be intense in terms of the noise that they have? If you are able to take care of what you need to do as a parent, well, say wearing noise canceling headphones where you can still hear them if they try to talk to you, but maybe drowns out some of it, or gives you some like low level noise that you actually like a music song you like, something. Some of those, sometimes there's white noise apps that have that people enjoy. Thinking about what can you do that will bring this down a little bit, because with irritability, if we think about it, if we're kind of, and when we're not irritable at all, we're at a 0. And when we're so irritable and frustrated that we can't help but like lose control, we're at a 10. The goal is to try to keep us from getting, say, into that 7+ range, because that's where it's going to be so much harder to do anything useful at that point. No one is good at doing useful things for themselves when they're super irritated. It's just how that state works. So the goal here is to do these things if it's starting to ramp up on the earlier side, even if you don't absolutely need it in the moment. So taking a break, figuring out if you're in a situation where things are annoying, like, can I go to the bathroom and just be alone and chill for a minute? Or can I somehow give myself even 30 seconds of something? Can I step out of a situation for a moment? Can I put a pause on this before it gets to the point where it's so much harder to do things to make it better? And also in part of this, thinking about what can you do that might be able to counteract some of the stuff that's irritating. So we call this self-soothing. So creating a plan and maybe even a kit with things and skills that reduce that agitation and arousal. And a lot of times great things are sensory. So smell, touch, taste, sound, vision. This could be things that you enjoy on any of these levels, maybe even multiple ones. Sometimes touch can be particularly grounding. If somebody puts something that feels like, I've known people who have like a rock that they like to hold that's also kind of cool, and there's something very pleasing about the texture of it. Like giving yourself a minute to enjoy something, having a cup of your favorite tea or coffee, for example, has a number of these aspects of stimuli that are soothing as opposed to the ones that are irritating. So with the idea of, again, if you're creeping up on that irritability, we want to bring it down a few notches and give you a little more space before it gets to the point where you might do something that you regret, or have it like yell at somebody, any of those things. We all want to keep ourselves below that level. Also, if people find breathing, mindfulness, visualization exercises useful, these can all be things that help shift focus and get you out of the space that is driving irritability for at least a little bit of time, and focusing on some aspect, whether it's within yourself, or frankly, I know when I'm irritable, focusing on my breathing is not really something that is going to get me out of that, but listening to my favorite song and just trying to pay like attention to that, or, another one that I think a lot of people like is if you slowly tense and release your muscles, going from your tippy toes all the way up your body, and you go through each single piece of your body, tense that, release that, move through there. It's a way, it gives you a thing to do and gives you a thing to focus on that's not whatever was irritating. And at the same time, it's relaxing your muscles. So it's a way to actually change how your body physically feels too. And for anybody, some of these things are going to work and some of them are not going to. So it's worth, and they may also work or not work in different moments. So this is such a trial and error thing. And it's about trying stuff. If it doesn't work, okay, moving to the next thing. And it's part of why most people are going to need a set of these in order for that to be useful. And just having one go-to one, it may not work in all situations. And then thinking about using these again preemptively before you need to use it. If you know that odds are high that you might end up irritable at some point that day, it's part of that part of your cycle where that's going to happen, using these skills preemptively when you feel the first inkling of that versus waiting. And the other piece that I want to talk about with irritability, and this is, I'm not going to go into detail of this, this is outside my expertise, but this is where considering interventions like SSRIs, which, and also something that's understudied in PMDs, but I've had people report seems helpful, is potentially a beta blocker. It's often propranolol. And the thing with most of these meds is that it seems to, through different routes, these reduce that agitation and arousal a bit. And again, they're increasing your bandwidth. And both could be used luteal phase only or as needed only, which I think is really nice because both of them work quickly in this particular case.
Sorry, I was just going to mention two things. So in terms of the using skills preemptively, I wondered if anyone could add in the comments any tips for remembering that, because personally I find, and I'm post-op now, but I still get blips, but I find, and especially back then, I found that I would just forget, and it would take me a few days to notice that things were starting. It would be my partner saying, "Are you okay?" And I'd be like, "Yeah, I'm fine. Are you okay? Are you fine?"
That's, I think, a great question. And this is
I'd
where
love to hear some patient sort of tips about that.
Where I think putting things in your calendar. So if you can predict when this is where that becomes so useful, having a calendar reminder. And if you are like many of us and your phone is always with you, you can even set up reminders to ping you at different points during those days to be like, hey, do you want to do something that will be useful for that? Or set, if you want to, it could even be setting an alarms at certain points during the day with a certain sound that for you is a cue of like, oh, right, I should do something that helps ground me a little bit. I should do something that helps center me. And this is where I think tracking that, and it's where, like, if you have a time where it really doesn't work, sometimes the best thing we can do when that happens is to say, okay, what can I learn from this? What could be useful next time? And so figuring out, okay, if that alarm is not getting, if you're not noticing it, then that means it should be something else. And some people, like people might want to go old school, like to have a Post-it note that they stick somewhere. Like if you're somebody who's sitting at your laptop for a lot of day or computer screen, and that's where it's happening, putting a Post-it note with just a couple quick notes of like that you'll understand about, here are my 3 skills that I'm going to try when I get annoyed, so that you literally see it.
It's just reminding me that in the toolkit link I shared earlier, there is a self-care plan in there, like an action plan. And I will share the link for that again in a minute, but that could be something really good to fill out in advance, because I don't know about anyone else. By the time I get to that stage, sometimes I don't even notice. I just go into this kind of like doom scrolling kind of paralysis, kind of sit there and don't really even, I know I'm not myself and I know I can't do the normal things, but I can't quite get there. So I will share that if anyone wants to download it and use that. And just really quickly on the SSRIs side of things, we are just in the final approval section of a new patient treatment guidebook, and it has a really comprehensive section on SSRIs. So some of the questions that Dr. Peters can't answer today, they are answered in there. I know we've had one about SNRIs and different dosages. So I think,
and that's frankly beyond my training as a clinical psychologist. So I'm just touching on these just so that because it's part of the treatment, but that information will be so useful, I think, to many people.
Yeah, I think so. Anyone that's asked about those, I will politely kind of move them off the Q&A so Dr. Peters can focus on her speciality, but know that there is information coming and it should be in the next couple of weeks.
And then, of course, stabilizing the cycle, whether that's through medications and hormone blockers, whether that's through hormones or surgery, may be what's necessary for people. It is worth noting that some progestins may also produce irritability for some people. We don't have really good information to understand who is hormone sensitive to menstrual cycle stuff and then how that relates to sensitivity to certain progestins, but it's pretty clear that that is a possible side effect. So it's something to be aware of when using any hormonal methods to stabilize the cycle and see if that helps, to keep an eye out for that symptom if this is something especially that you struggle with. And then if it's getting worse, talking to your provider. I also want to talk about other forms of anger, because irritability is really that you can almost feel it's almost like this physiological thing in your body. Sometimes it's also affecting your brain where everything is overwhelming. There's other ways in which we see anger in the cycle too. And I especially want to talk about something called secondary anger. And so when we have anger just as an emotion, it can be primary, and that's when it's a direct response to something. So if Laura would never do this, but if she said something really mean to me or said something really unfair to me, and then I got mad at her, that would be kind of anger doing its job, right? It would be telling me like, that wasn't okay. And then I'd act on that. And that's why we have anger, frankly, is we need to be able to respond in those situations with anger. Anger can also be secondary though. And in this case, there's an other underlying emotion that we may or may not be aware of. That is then we're responding to that with anger. And so some common ones that this can happen with is people feel shame, they feel anxiety, sadness, feelings around rejection. That can be kind of the initial feeling. And sometimes it's so fast that it switches to anger that we may have no idea. We're just mad. But underneath that anger can be another emotion. And a lot of times when anger is causing real problems for us, it's this secondary form. And because then there's a problem, but responding angrily may not be the thing that actually solves that issue or deals with that problem that we're experiencing. And so, yeah, again, when anger is disproportionate to a situation or doesn't fit a situation, that is a good clue that at least some of it may be this secondary kind of anger. And there may be more going on than seems initially obvious. And this is important in terms of the cycle, because we also know that interpersonal vulnerability and sensitivity is one of the things that fluctuates across the cycle. And it seems that can be part of having that irritability. It can also happen even if you're not feeling irritable, that we have this heightened interpersonal sensitivity. And this can look like rejection sensitivity. So expecting rejection, like from the get-go from people, can be part of rejection sensitivity. Being more likely to interpret situations as rejecting. So the classic example I think of this is if somebody texts you something, like you ask them a whole bunch of things and they go, okay, that could be read a whole lot of ways, right? No emojis, no exclamation point, just okay. And maybe that person is just quickly dashing off, okay. Maybe they're being a little weird about it, if that's not their usual way of interacting. There's a lot of possibilities behind what that okay means. And when we're feeling rejection sensitive, we're way more likely to think like, oh, I think they're mad at me. Like that seemed like a little off and they're mad at me. And that may be the only possibility that we consider when we're in a state where we're feeling more sensitive to rejection. And then also having a stronger response to feeling rejected. So that rejection feels more intolerable, more of a big urgent problem than it would maybe some other times. And a related piece of this is also feeling invalidated. And invalidation, there's aspects of it. So it's being told that feelings and thoughts are wrong, bad, not real, legitimate. And again, this can be something where there's an element of it, which is, and the piece that matters a lot of times is whether you perceive something as invalidating. So an example is for if I'm expressing worries about something happening at work to say my partner, and I'm upset about it, and then they respond, I'm sure it'll all be fine. You have nothing to worry about. Some people might find that reassuring. Some people might find that like, this is thank you, that's helpful. Some people might find that invalidating and saying that, oh, my worries are irrational, like you don't understand what I'm saying. You're clearly like it feels almost judgmental at times. The same words could feel really different to different people or to the same person in different states. So if I'm more emotionally raw, which can happen for probably most of the folks here premenstrually, then I might be more likely to experience that as invalidating and have the feelings that come with that. And so again, another piece of this is then having a stronger response to invalidation and having that be more overwhelming. And so between all of these things, this is a lot of potential intense distress and interpersonal distress in particular. And sure enough, when we look at what people report across the cycle, we see that rejection sensitivity is something that shifts across the cycle for people. And we have that same premenstrual increase here. And this is looked at less often, but we do have this in one of our studies. Same thing for feeling invalidated. And so these two pieces of potentially really potent interpersonal distress may be part of what's going on premenstrually for people. And so how does secondary anger come into this? It may sound counterintuitive or odd, but anger actually has some similar characteristics to positive emotions. It can feel kind of empowering. It can make you feel validated. It can make you feel motivated. And in some ways that can make it more comfortable than feeling, say, really terrible about yourself or feeling really ashamed or really worried about someone rejecting you. And it may, by increasing anger, sometimes we can decrease that self-directed distress. And this is not necessarily something people are doing consciously, but it's a thing that our brains may learn to do. And the problem with that, though, potentially, is in the long term, it may increase risk for being aggressive with people, being impulsive and reckless, because when we're angry and worked up, we're less likely to think things through, having unstable relationships, and it can also stay internal. So somebody might be feeling all these things, but not expressing it, but then that's likely to wear on them and cause stress and tension. So this is, for most people, not something that if you do it a lot or you do it intensely is going to be that helpful in the long term. And there's a couple ways that this tends to happen for people. So one is anger, ruminating on anger. I think of this as angry hamster wheel thoughts. Your mind is going and going and angry, and you're thinking about what got you mad, how you wish you reacted, what you would say to that person if they're here, but you're not actually solving a problem. You're just going around and around like a hamster wheel. And I found this meme that to me expresses how I feel when I'm anger ruminating. So this is my hamster wheel anger rumination image that I find very relatable. We all do this sometimes. Some people do it very infrequently. Some people do it a lot. And then this is definitely something that can be part of this premenstrual set of symptoms people have. And I also want to point out that there are other ways that we can increase anger. And this is something that I personally study and am working on ways to measure, but purposefully engaging in things that are likely to increase anger. And this could be anything from having visualizations or fantasy, like imagining doing something to somebody that is really making you mad and kind of getting into that mode. Co-rumination, so talking back and forth like outside of your head with somebody, but in a way that works things up. Also, attending to or seeking provocation. So I don't know if anyone here can relate to this, but looking at a news story that you know is going to make you mad and then clicking on that comment section where you know beyond a shadow of doubt people are going to be saying stuff that you find enraging, dumb, like really upsetting, and going in and choosing to look at those comments. Because when we do that, it's usually a choice. We're acting in this way. We are making a decision that's likely to increase anger. And so this may be something that some of us do at times to regulate those emotions, to, again, maybe it feels a little better to be angry than feel horribly ashamed, for example. And while I haven't yet measured those other forms of anger upregulation across the cycle, we have some pretty good data across a few studies now that show that anger rumination, that those hamster wheel thoughts do indeed go up with these other symptoms, and are one of the things we see that big luteal effect for. Relatedly, probably, we also see a similar effect for reactive aggression. So people impulsively yelling at someone, getting mad at them, acting out against them. And my best guess is that this is related. And so when you think about how to cope with this kind of anger, I think it's really helpful just to recognize as a starting point that this might be a thing that's going on sometimes, and validating that function. Like, it makes sense that your brain might be doing this, or it makes sense that, like, okay, I'm dealing possibly with other intense stuff, and this is what my brain's learned to do. And I like to do an exercise just really of what else is there. So the anger is usually really more obvious for a lot of people, and the ways it makes your body feel, the thoughts going through your mind. But if you can notice that and then think, okay, is there anything else there emotional? And take a few moments to be with yourself, to try to be open to that, and notice if other emotions come up once you push past that anger. That can give some sense of like, oh, is there something else going on here that I need to attend to and take care of? And it might also involve some different responses or skills or self-care than that anger piece. So limiting impulsive responses to the secondary anger, because a lot of why, like, it's both directly not great for people a lot of times, but a lot of the impairment comes in when people get angry and then they engage with other people or they do things they regret. So trying to figure out if you're getting worked up, if you're feeling really angry, and especially if that's coming at that point in your cycle, giving yourself permission. If I'm still mad in a few days, I'm going to really chew this person out, but make that however many days you need to get past the point when this is more of a symptom for you. And sometimes that can feel like, okay, I can wait as long as I know I'm giving myself permission that if this is still really bothering me, I'm going to say what I think, and also activities that match that high arousal, but shift focus to feeling like good about yourself. So something for some people that might be exercising, something that similarly gets you activated and going. I've known people who like intensively clean as a piece of this. And it's almost like a little bit of, it starts off kind of angry cleaning, but then can shift to feeling also like, okay, I've got this place clean, and help bring in some other feelings. Hitting stuff, like having a pillow that you hit, something like that. Always better to hit a pillow than a person. So I just want to put that out there, but it's usually best as a last option. Like if you can do one of these other things, that will probably be more helpful in the long term, because sometimes when we get that catharsis, when we hit something because we wanted to hit someone and it feels good, then that can kind of reinforce that tendency. So it can make us more likely to get angry in that same way again. So again, always most important to not harm people. So if a given moment, your options are hit a pillow or go off on someone, fair enough. We can only do what we can do in these moments, but it's probably not a first line choice that we want to make. And then increasing tolerance of feeling of shame, rejection, and skills to respond to those emotions. So thinking about, okay, how can I have those feelings? And this is often going to be something you probably want to work on with a therapist if this is something that's really resonating for you. But maybe in your follicular phase, or whenever in your cycle is your better part of your cycle, trying to do some of that work first. And I will note that also, if secondary anger can, for some people, maybe have a protective function, because it's like, if I feel really terrible about myself, I'm going to get worked up and angry, or I'm going to hurt myself. And so in those cases, it is probably important to be working with a therapist, to be working with them and considering, okay, how do I make sure that I have other options in my toolkit for how to work with my emotions besides those, before just saying, okay, I'm going to do my best to stop getting angry, if then my only backup option is something like self-harm. And then thinking about, again, in these moments, wanting to work on minimizing conflicts, it's really okay to decide to gently avoid something. And by this, I mean, if something is frustrating, hard, difficult, we don't want to avoid it forever. But if there's a time limited point where this is going to be so much harder for you to deal with, it is a perfectly reasonable thing to stay engaged instead with things that make you feel good about yourself, they bring mastery or pleasure with low conflict potential. We don't want to avoid things forever, but avoiding things for a few days, it's a reasonable thing to do. And a lot of people who manage, who are working with cyclical symptoms, this is something that ends up being useful, is thinking about, how do I keep myself out of trouble sometimes by literally keeping me out of those situations. It's also worth noting that it can be so easy to potentially misinterpret cycle-based symptoms, and this is for irritability or anger, as being due to other factors. So if I'm feeling really irritable and I'm just having that moment and that's rising in me, and then somebody in my life says something and that brings out this intensity of the irritability, I may start thinking this person's a jerk. I might start thinking I want to break up with them if I'm in a romantic relationship. All sorts of things could flow from that. And that feeling in that moment is real. I am not saying that it's not a valid feeling. It's not an important feeling, but it might not serve me well to attribute that fully to that other person. Maybe I attribute it a little bit, maybe they said something kind of annoying, but it's going to be important to consider whether the cycle is part of that. And so balancing validation, this feeling is real. It's something I need to take care of. It's something I need to help myself with a gentle kind of fact checking. So I think any of these things can be handy to have written down in your phone, wherever. So you can have access to these. And this is good stuff to do when you're not feeling bad in the moment. So writing down how your cycle typically affects you. Yeah, it makes me pretty irritated. And then little things make me so much more annoyed than normal. If I have that in, say, could even be my screen background if I was comfortable with that, or in an easy to get to thing in my phone, and I start training myself to check that, it's okay, that's probably maybe part of this. I should consider whether it is. Can this interpretation that I'm having wait to be acted on? So if somebody's really annoying me and frustrating me, and I need to go get away from them, like do that, right? Go try to get your space, take care of yourself. But maybe the decision about, again, if this is a romantic partner, do I want to break up with this person? Okay, it's like that. I'll break up with them if I'm still really upset about this in a week or two. Giving yourself permission to delay things that really like act on your interpretation of the moment. And this can be hard in the moment. So I think this is something, again, doing in some ways outside of the moment. If you have things that typically go off for you, like a lot of times it is people engaging with partners or family, and a way that it typically bothers you much more when you're in that irritable state than you are the rest of the time, maybe trying to think about, okay, am I sometimes missing alternative explanations to what's going on? And it would be helpful to have a note about that to myself. Like they might not be actually trying to, like they may not be mad at me, or they may not be judging me. Like, and similarly, if you have that person in your life and most of the time you feel like they're a good person and they're helpful and you like them, but then in these moments you can feel very much not like that, having a little few notes about how this person typically acts, things about their relationship. Like, I know even when I'm annoyed at them that they care about me, because sometimes in the moment it is really hard to feel that or to remember that. And so having those pieces could be really useful. And then again, same thing as before. Do you want to put a post-it note somewhere? Do you want to put it in your phone? Like, do you want it multiple places? What is going to work for you? And that's a trial and error. And like, you know yourself better than I know yourself, any of you. So like, you're going to be the expert in thinking about how can you have access to that. And this is, again, like we were saying before, adding to the phone, adding to the calendar. This way it could be preemptive, like you have a little reminder that comes up every day during the part of your cycle that you tend to be really irritable about a few of these things that seem important to you. I think it's really important to work with the people in your life when you can. Not everybody, like with the full acknowledgement that there may be people in relationships where, for example, their partner is not a safe person to do this with. So this is with the caveat of if you have somebody, even if they're kind of in a middle ground, for example, like you think they care, but they often cause some issues for you. If you feel like you can have any kind of collaborative relationship in a reasonable way, thinking about how to work with them in managing this stuff. I mean, first recommendation, couples therapy with a therapist who either knows about, if you're lucky enough, but more likely willing to learn about PMDs. And then regardless of if you're in therapy or not, creating plans together when you're feeling better. So, and it's hard to do this because when things are going well, very few of us want to go like, you know how things are sometimes not going well? And you know how we sometimes get into those big blowout fights? It's really hard to bring that up when you're like, no, this is the week that I feel good. This is the week I want to just enjoy. But I'm going to encourage you to try to find a time to do it anyway, because when it's in that moment, when it's really hard, that is the worst possible time to try to do work that and to work with your partner. So doing that when you feel good, making yourself do it. It's not fun. We have to do it sometimes, though, is helpful. Some ideas on what that could be: tracking experiences daily. For those of you who rate your own symptoms daily, maybe they want to write their feelings, and then you can, and I would say, like, it can be a little loaded if they're rating what they think is going on with you. If that feels like a safe thing for you to do, great. If that feels like, I don't want them doing that, they can rate their own experiences. Like, how are they feeling? And then you can share that together. And that may make it feel more like a collaboration. And like maybe they're feeling confused and off center at times that you're feeling irritable. And that can be a really nice starting point to start to work on some of these things together. And figuring out language for two important things: expressing concerns without invalidation. So figuring out, is there a way that if your partner is thinking, maybe this is like PMDD coming up, can you work together to think of a way that, like, because sometimes people will say that, in a way that's really invalidating. Like, oh, is this just your period? Or is this just like your premenstrual stuff? If that's going to be not a good feeling for you, which is understandable, thinking about how can they express like, hey, do you need support like with what's going on right now? Or are you having symptoms that you need help with or that I can accommodate in some way? So I think that working with them to figure out how can they say what they want to say, but also have it be something that is not upsetting and invalidating and rejecting for you is really useful. And this is the kind of work that's not going to happen when people are irritable in the moment. Similarly, we all need to get out of situations sometimes, and that might be you, that might be your partner. It's probably sometimes both, where it's like the most adaptive thing you can do is give the moment some space, leave, take a break. And one of the things that's difficult is that, for example, if I'm feeling really rejection sensitive and irritated, and they're like, I can't deal with this right now, I might feel like really rejected and more upset. And then, I don't know, maybe follow them out the room or something, right? So this, and then it's not doing what it needs to do. So sometimes even finding like a weird phrase or word, because it doesn't have the loading, that you guys agree, like we're defining this as, I love you, I care about you, and I'm taking a breather for both of our sakes. And if you're like, I don't know, banana, like, or something is that, then in some ways that can also help jolt out of the moment. Like, that's why I like using a random weird phrase, make it something that is an in-joke if you want, but it helps disrupt the moment. Plus it communicates that thing, because otherwise it can be so hard to extricate yourself, for them to extricate themselves from a situation and de-escalate conflict. And then finally, so important for family and partners to have their own support and therapy. And IAPMD has that in terms of support groups, but then also they may want their own therapist, and that could be really useful for both of you as well.
I think this is an interesting one. So I enjoy drinking wine in the evening, but I expect that alcohol is not advised during this time.
Yeah, so here's a suggestion. If you're like, it might not work, but also I really like it, because I would say, well, then you should only not do it if it causes problems for you. And it's really hard for me to say whether that will cause problems for you, because I think for some people it might. It brings down inhibitions. It can get us a little more ready to act. That could be not helpful. My suggestion is track your cycle, and then you can do one of two things. Either try a cycle where you just decide not to for that one period of time and see how that goes. You can also even do some things where it's like, if you have a whole week that is really makes you feel irritable, do like a couple days where you have your usual glass of wine, a couple days where you don't. See how it works, because my guess is that if you stop doing it and it makes a big enough impact that's noticeable in terms of how these things go with you, like the wine is going to seem less appealing if you realize like this is making it much worse. If you can't really tell a difference, then I'm not going to tell you, or I wouldn't tell a patient of mine to stop doing that. So some of this, because it's different but for people, and also we have limits in our research, is really a trial and error thing. So I encourage people to do that.
Okay, thank you. And also, I think Aaron is here with us today. If you are, can you, Aaron admins on one of the partner support groups on Facebook, and he also runs one of our video support groups. If you can possibly pop the link or the name of your group into the chat bar, that would be really helpful. And I also wanted to say, I know someone is sharing their phone number for a WhatsApp group. Please do be careful sharing your number on a public forum, and anyone joining that group, please just be mindful and careful as can be. Let's have a look. Do you have any comments or research around treatment for those people living with PME? so such as bipolar, psychosis, and I know someone also mentioned borderline personality disorder, which, as I know, is a real focus of your work.
Right. So my own research is on PME of borderline. And I think that for anybody who it makes it more complex in some ways, because you both have the hormone sensitivity piece of it, and you may have other pieces going on as well. And so I think that is one of the many times where working to treat both. Some people, my preference is to try to treat both at once, because this is, for most people, causing enough impairment that I don't want to wait for things that could help. But it's worth, so for example, when working with PME of borderline, that's probably somebody who's going to benefit from a lot of these skills, a lot of this, that's the first line treatment for BPD. So I would say definitely be in some kind of evidence-based therapy for that if you can, like dialectical behavior therapy. There's also good workbooks and other things available if for some reason therapy isn't accessible to you. And doing that along with exploring these pieces about applying the idea of, can I predict these symptoms? Can I factor that into how I manage it? And also considering if there are hormone sensitivity specific medications. I honestly suspect that there are people who have other disorders who take an SSRI. It treats hormone sensitivity that they maybe didn't realize they had, and that's part of why it helps some, but not entirely. So that may be a piece of it as well to think about.
Definitely. And thank you, Aaron. Aaron's added the groups for partner support and his email there, if anyone wants to check out that. I'm just going to go to one quickly, because I know a lot of people kind of asked a similar kind of question. If you had any, where are we? Any tips in dealing with shame and rejection, and also any tips in ways to try and increase emotional exposure to shame and rejection?
Yeah, that's a great question. So I think the first tip is that, there are times where these things, we're supposed to have some feeling in response to it. It'd be weird if people rejected us and we didn't care at all. It would be probably also in a weird, I know that shame is something most of us find so aversive, but if I did something that was genuinely really bad and I was shameless, that wouldn't be great either. So there's pieces in which these emotions, all emotions, have their functions, but where it gets out of hand for us is when they get so intense. And a lot of that comes with when we pile on, right? Our brain piles on automatically. And instead of feeling a little bit of shame about something, and maybe it's something where it's okay, I do need to work on this and change this about myself, but now I'm beating myself up in it. That shame is going from this to a huge intolerable thing. So practicing self-compassion, practicing validation and understanding. So for example, I may not be perfect and I'm trying really hard at the same time. I like and statements for this kind of thing. I may not feel good about how I handled that interaction, and I'm also working really hard about this, and I'm going to try to do things differently next time. So giving yourself that space to assure yourself, because if you're having a thought going through your head, and a lot of times these feelings come with thoughts, that's beating yourself up. Is there another piece that's missing from that? That is a kinder, gentler thing. That if, say, one of your best friends told you about that thought, the thing you would say to them probably, yeah, you had a rough moment and you're otherwise a really caring, wonderful person, right? So practice trying to treat yourself as though you're someone you like, which many of us don't do. We really don't treat ourselves like we like ourselves. So that can be a helpful exercise where it's what would I say to someone else going through this who I care about and respect? And I think for the exposure piece of it, that is something so we do this, we broadly as therapists in therapy at times where it's okay, is there a time where it feels safe to bring up a feeling of your memory of something that made you feel a lot of shame? And then again, practice some of those compassion skills. What would it be like to also be kind to yourself and to that person and that memory. What might you say? What might you think? Are there things that it's like, actually, when I think about it, you know, even if I did something I don't feel great about, I can really understand where I was coming from, or like why this is something that has, like, I learned in my childhood. It makes sense that I did that, you know, and those pieces of it. Can you validate yourself? Can you be kind to yourself? So those are the pieces where I think doing that deeper work on shame, and with rejection, I think that it's similar. It's thinking about how am I bigger than this moment, bigger than this relationship? What are the things that I would say, you know, again, to somebody else who's like, oh, this person rejected me. How would you reassure someone else you cared about? And then think about how could that apply to yourself? So those are, to me, some of the most fundamental skills. And this is something, so even if you can't find, for example, a therapist who really understands premenstrual disorders, this is the kind of thing that there are a bunch more therapists who may understand how to work with this piece of it. And while I wish I could say that you'd find someone for sure who understands premenstrual disorders, you may need to bring that realistically to it a little bit and say, like, look, I have this problem in these moments and not in these moments. Can we use that as a way to work with this? And again, it's unfair that you have to bring that in and you may have to educate them a little bit. It shouldn't be that way, but it might be the most effective way to get some treatment.
Definitely. And I think also it's really important to say that these skills kind of need to be practiced. They're like, you know, any kind of muscle memory, you know, just trying to pull them out the bag during the bad times,
yes,
is really difficult. There's something that you need to practice and work on and do homework.
Yeah, it's something where this happens, like with patients of mine a lot, is that people understandably immediately want to do the thing in the moment where they need it. And sometimes I even recommend against it if it feels like that is such a hard ask that it's likely to just not feel doable at all, because then it's going to be like, well, this doesn't help. This can't be something I use. So I usually actually tell people, before you even try to do this at the hard times, try it at the times where you really don't need it. Practice that then, and then you can start bringing it into there, but you'll have already felt a little comfortable with it. You'll be sold on it, frankly, a little bit more as something that might be useful too. Someone asked about suggestions to get out of the moment when it's already like pretty into it. However you can is like honestly my answer. And sometimes that might be something that itself is a little bit conflict causing, like, but if it's going to be better for you to walk out of that room or do something like that, I think that there's always going to be times where we should have disengaged before it gets to that point. It can be helpful then after that point to think through, when the two of you feel better, like, what could have been useful at some point? Where could we try to do this better? Because our tendency is, once the moment's over and the conflict's over, to not want to even touch it with a 10-foot pole because now it feels better. And so we don't want to talk about the bad thing. But that's my other piece, is that sometimes it's going to get screwed up, you know?
Yeah.
And then we just have to try to figure out, okay, what am I going to try next time?
And I think that is where, for me, peer support came in really, really useful, because I think learning what other people do can be really useful. Because one of my things was storming out of the house, and was often doing it late at night, which is dangerous, you know, unfortunately, with the world we live in. And someone said, go to a supermarket.
Yeah.
Go to a supermarket.
Right.
It's bright, it's light, you know, which isn't great if you're oversensitive.
And you may want to have a backup, like an errand like that. I think that's a fabulous idea.
Yeah, just going, get a magazine, if nothing else, sit in the car, have a cry, but be somewhere safe, so that, you know, if you do have to act out and do these things, if you do just need to be out of the house and away from that person or people, that you have a safe plan in action. And someone said, oh dear, that's why I buy so much stuff. Well, yes.
Right. And then it may be something where it's like, okay,
action.
if you've gotten that down, is there another level that you want to work on it? Because that's the thing. It's like, none of us fix stuff that's hard right away, or even ever fully usually, but we build our skill set and we come up with more options that work over time.
Yeah, definitely. And I think,
be kind to yourselves.
Already, there's so many comments in the chat about doing the same things, taking, going and sitting in the car and streaming favorite show, things like that. It's just, really, really helpful. But, you must keep yourself safe, obviously, above and all. But we're going to wrap this up now.